Mesothelioma is a cancer of the mesothelial cells of the body. These cells are found on the outer layers of tissue that line your internal organs, the mesothelial lining. These linings help your organs to be able to move as needed within the body. This very deadly cancer is usually only found in those that have been exposed to asbestos. Asbestos was used in many industries in the past and is a highly cancerous substance. Breathing in the dust of asbestos can lead to any of the many types and forms of mesothelioma, even many years after exposure. The type of mesothelioma is classified according to the cell type of the tumor as well as the location the cancer is found. If you receive a diagnosis of mesothelioma, it is important to inform yourself with general knowledge about the disease as well as much information as possible regarding your particular diagnosis. This will help in knowing what to expect and aid you in making decisions about your treatment along the way. There are three main types of mesothelioma found with this diagnosis that refer to the cell type of tumor found within the body. These are epithelioid, sarcomatoid, and mixed biphasic. Epithelial mesothelioma, epithelioid, is the most common and is found in 50 to 70% of cases, which means that 5 to 7 cases out of 10 are found to have this form of mesothelioma. This is when the cancer has originated in the epithelial cells within the tissues surrounding the internal organs. Sarcomatous mesothelioma, or sarcomatoid, is when cancerous tumors originate in the fibrous tissues or membranes of the mesothelial lining. This type is found in 7 to 20% of cases. This means that just 7 to 20 patients within 100 will be found to have this type. Many patients have a third type called mixed or biphasic mesothelioma. This occurs when a mix of both epithelial and sarcomatous involvement are found. This is the second most common type next to epithelioid, as 20 to 35 patients out of 100, or 20 to 35%, are diagnosed with mixed biphasic mesothelioma. Diagnosing mesothelioma is often difficult, as it can often look very similar to other cancers and can also develop into further types of cancerous cells that each look different. These further divisions of cancerous cells are then classified into other types that include small, clear, acinar, and tubopapillary. Another way in which mesothelioma is classified is by the area of the body the original tumor is found. The most common area it will develop in is the pleura, which is the tissue membrane surrounding the lungs. This occurs in 70 to 80% of diagnosed cases. According to statistics, you are then most likely to have epithelial and pleural mesothelioma. Mesothelioma can also be found in the peritoneum, or the abdomen. Peritoneal mesothelioma is the second most common area in which this type of cancer is found and occurs in 10 to 20% of cases. This happens when the cancerous tumor develops within the membranes lining the abdominal organs. It can also develop within the membrane lining the heart, called the pericardium, although pericardial mesothelioma is extremely rare. The mesothelial lining in which the cancer develops is a tissue membrane that surrounds the organs to help them move. For example, the pleura around the lungs aid in movement to help us breathe, and the lining of the heart helps in movement as our heart beats. The organs within the abdomen also have this lining, which help the organs move around with our body movements. Benign mesothelioma is another type of this disease that is usually found either within the pleura of the lungs or the reproductive organs. This happens when tumors develop that are benign, which means they are not cancerous. While this is possible, it is an extremely rare occurrence, as almost all cases of mesothelioma are caused by cancerous tumors. If you have been exposed to asbestos and are experiencing even vague symptoms, such as shortness of breath and chest discomfort or pain, you need to see a doctor right away for a complete evaluation. He or she will start with a physical examination of the body and will also listen to your chest. You will then either be sent for medical tests or referred directly to a specialist that will conduct the tests necessary for an appropriate diagnosis. X-rays are usually the first test done in searching for a diagnosis. Other tests you may also need include CT scans and thoracoscopy. Thoracoscopy involves taking a biopsy of the pleural. A biopsy is the removal of a small piece of tissue for examination. Other tests that aid in diagnosis include thoracentesis and abdoparacentesis. This is when fluid is drained from a particular area. Thoracentesis takes the fluid from the lung, while abdoparacentesis removes fluid from the abdomen. This fluid can then be examined to achieve the correct diagnosis. With so many types, classifications, and forms of mesothelioma, it can become very confusing to you as the patient. It is very important to talk to your doctor about any part of your diagnosis or cancer type that you do not understand, as you will most likely be faced with making decisions in your future treatment and care. Receiving a diagnosis of mesothelioma is scary. However, arming yourself with knowledge about your disease will help you make better decisions, as well as let you know what you can expect about your treatment and prognosis.
Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.